This podcast is brought to you by the IIEA, sharing ideas, shaping policy.
Welcome, everyone. It's my great pleasure to welcome all of you today at this seminar organized by the Institute for International and European Affairs. This webinar is titled Shaping Inclusive Futures, the EU Strategy for the Rights of Persons with Disabilities and its Global Implication. And this is the first webinar of 2025 and the first event in the new Disability Policy Program, which is part of the Social Policy Program. I'm absolutely delighted and thrilled today to have the opportunity to share this event because we have an amazing speaker, Inmaculada Placencia Porrero, senior expert in disability and inclusion at the European Commission. She's also a member of the UN Committee on the Rights of Persons with Disabilities. Before introducing Ima, I just want to say a couple of things about how we will run the webinar. So we will begin today with our keynote, 20-25 minutes, but then we will have a good time for question and answers. And I would like to ask you to use your Q&A function on Zoom, and I will read out your questions. I will say something about that later, so don't be afraid. I will be able to guide you through the question and answer session later, but I just want to mention that you will have that opportunity. And I ask you to write your name and affiliation where appropriate so that I can identify you when I read your question. I want also to remind you that the webinar, so both the keynote and the question and answer session, is on record. So we are recorded. And now, after these few organizational points, I just want to introduce our speaker today. So Inmaculada Placencia Porrero is a senior expert in disability and inclusion at Directorate General, Employment, Social Affairs and Inclusion at the European Commission. Her unit is responsible for the coordination of European policies for persons with disabilities. She's also working on European disability policies at large, including the European Disability Strategy and the implementation of the UN Convention on the Rights of Persons with Disabilities in the European Union. Inmaculada has been a driving force behind the European Accessibility Act. She has extensive expertise on accessibility and e-inclusion. She has worked in that regard with the DG for Information Society and Media within the European Commission. Among other accolades, Ima has also been appointed quite recently as a member of the UN Committee on the Rights of Persons with Disabilities. And this is the first time that an EU representative has been elected to a UN body. And I think that speaks to the quality and incredible expertise that Ima brings to the table. Without further ado, I would like to give the floor to Ima for her keynote. Thank you for being here today.
Delia, yes, for this nice introduction. I hope you can all hear me well, and thanks for the organizers for inviting me to this series of events to provide you an overview of what the European Union is doing in relation to the rights of persons with disabilities. We know that in Europe there are about 90 million persons with disabilities, and this figure fluctuates through the years, but we see a slight increase year after year on the numbers of persons with disabilities. The EU is a party to the UN Convention on the Rights of Persons with Disabilities since 2011, and it is the convention that is really now shaping the European disability policies, confirming that these disability policies are to be addressed from a human rights perspective. In order to implement the convention, we have adopted a European disability strategy that goes from the year 21 to 2030. It is not the first strategy. It is not the first plan to implement the convention. In fact, it builds on previous strategies and action plans that date really even from the 90s. The strategy is being set in the context of the other social policies of the Union, such as the European Pillar of Social Rights, that contains a specific principle on accessibility. And it is used for different mainstream policies, such as, for example, the European semester. We know that with this strategy, the intention is really to ensure that persons with disabilities can enjoy their human rights and fundamental freedoms, and that they have the same opportunities in the Union like anybody else. The strategy, as I said, contains actions to implement the obligations for the EU under the CRPD, but it also provides support to the member states to fulfill their obligations under the convention. It contains a section addressing international action, so external action of the Union, but also an internal implementation of the convention and our own internal disability policies in the EU institutions, both vis-à-vis interactions with the public and employees with our internal employees with disabilities. Now, how is the strategy shaped? The strategy contains 8 areas, and in my presentation, I will briefly go through each of the 8 areas, and it contains 7 flagship initiatives, which I will also briefly indicate what has been achieved on those. And it contains 57 specific actions for the Commission and 23 calls for the member states. So in areas in which they often have and hold their own competencies. So the Commission tries to move forward also in the these national policies. So the first area of the strategy is about accessibility, and accessibility as an enabler of rights, autonomy and equality, and accessibility to, in a wide sense, to the built environment, to information and communications, and transport and infrastructures. The intention in this area is to consolidate the implementation of accessibility legislation, addressing different specific accessibility legislation, such as the European Accessibility Act of the Web Directive, but also mainstreaming accessibility in other existing legislation. For example, public procurement requires accessibility to be used when spending public money or on the EU funds. In order to do that, and support that process, the Commission created the Accessible EU Resource Center, which is one of the flagship initiatives, and with the intention to build capacity on accessibility in the member states in the Union, so that they are these experts on accessibility would be able to implement the obligations that are on accessibility in EU law. And the idea is to create a community of practice, connecting stakeholders, and provide some training to that end. It is important to know that when we launched the strategy, there were millions of persons with disabilities experiencing barriers in transport, that they faced barriers to use transport, and that, to give you a simple figure, 64% of persons with disabilities have an internet connection, but when you look to the general population, that figure is almost 90%. So I will be giving you a number of figures throughout the presentation to show the disadvantaged situation of persons with disabilities. These are indicators that help us to monitor the impact not only of our EU legislation, but also other national legislation, because it is the joint result that we are measuring. Now, we have the second area of the strategy is about enjoying EU rights, and it's about moving and residing freely across the Union. And because persons with disabilities should enjoy all rights on an equal basis with others, including this right to move and reside freely, which, while it is an stated right, I mean, there is no EU law saying the opposite, the right applies equally. In practice, it is complicated to enjoy that right on equal basis with others due to difficulties with the recognition of the disability status in other member states. To that end, the Commission adopted the European Disability Card, which is the second flagship initiative that I'm referring to. And the aims of the card is to promote the rights to free movement in the EU, as I said, but it is about recognizing, having a document that facilitates the mutual recognition of disability. The card is based on mutual trust across member states, meaning that the assessment of a disability in one member state is recognized on the other. I want to clarify that the rights are about preferential conditions, access to preferential conditions or treatment of persons with disabilities, but does not apply in the area of social security coordination, for which there is a specific regulation. So it's about access to culture, sport, transport, that this card is going to be used, and mainly in general on access to service, those conditions that are addressing persons with disabilities at national level on accessing to services. The proposal of the card was done almost 2 years ago now, and the directive has been applied. Also adopted also another directive for the persons coming from outside the Union. And in the same proposal, we have now a directive for the European parking card, also to recognize those rights. In this area in this area of enjoying EU rights, also we have a number of activities that address the participation in the democratic process. Still, we had figures at the beginning of the strategy that about 800,000 EU citizens with disabilities did not have the right to participate in European elections through national reforms this figure has been significantly reduced. I think the last figures that I heard were about 500,000, 400,000, which is still much, 500,000 people too much, that do not have access to the vote and being elected, because often this is linked to the denial of legal capacity. And in order to improve the situation, the strategy commits to support the member states in making the elections fully accessible, and that there is a guidance provide on good electoral practices, and to work on the member states on this issue of the recognition of rights. The third area that I'm discussing here is decent quality of life and living independently. Here, the objective is to develop independent living and reinforcement of community-based services. At the moment of writing the strategy, we calculated that about 1 million children and adults with disabilities age less than 65 and more than 2 million adults above 65 live in institutions. These figures are estimations because there is no concrete measure of the numbers, but also there is no concrete measures of the situation in which persons with disabilities live in institutions. So the strategy recognizes that independent living and quality of social services, as well as accessible and inclusive housing, are indispensable for decent living of persons with disabilities. And with the uptake in this Commission of new initiatives in relation to housing, we hope also in the second phase of the strategy, we would be able to give a boost to the issue of housing. It is acknowledged that all persons with disabilities, regardless of the age, have the right to live independent and in the community. And to that end, the strategy has one flagship initiative, which is a guidance on independent living to support member states to give effect to this right in Article 19 of the Convention. So the guidance contains good practices on the institutionalizations, notably when implementing EU funds, and it includes reference to the area of mental health, and it contains guidance to strengthen the transition from institutional care to living in the community. And linked to this, there is another flagship initiative, which is about the quality of the services in the community without changing our societies, making them disability inclusive, having services that are accessible and mainstream services that are accessible, but also targeted services for persons with disabilities. The transition to the living in the community will be a big challenge for persons with disabilities. To that end, as I said, there is these other flagship initiatives about developing a European quality framework for social services of excellence for persons with disabilities, in which we are still working. The next area that I would like to refer to is about decent quality in the area of decent quality of life, is about developing new skills and new jobs and fostering access to quality and sustainable jobs. The strategy indicates that the best way of participation is the best way to ensure economic autonomy and social inclusion is participation on employment. And to that end, we have a number of actions put in the strategy, one of them being the full implementation of the Employment Equality Directive that dates already from 2000, but challenges have been shown in terms of putting to work the obligation of reasonable accommodation that is enshrined in this directive. Also, we have an action plan on social economy, and there is the Commission has asked the member states to establish targets for increasing the employment rates of persons with disabilities. One of the flagships in this area is the Disability Employment Package. And the package aims to improve the labor market outcomes for persons with disabilities, seeking cooperation with public employment services, social partners, and organizations of persons with disabilities. The package contains guidance in relation to all phases of employment, from announcement of advertisement to recruitment, going through accommodation and maintaining a job, a manual for chronic diseases, and vocational rehabilitation schemes. The package is adopted, and we are working on its implementation. Also, we have a study that is going to be published very soon about different forms, alternative forms of employment, including sheltered employment, which is an issue under the UN CRPD, but it is also a reality in Europe. So with this study, we hope to gather more information, data, and see what are the challenges, so that the labor rights of persons with disabilities are recognized all across the Union. We have also some activities related to consolidating the social protection systems. And because access to adequate social protection, including in retirement schemes, is an essential prerequisite to ensure an adequate income for a decent standard of living of persons with disabilities. The issue is that quite often there is not a direct connection between the additional cost that a person experiences because of barriers faced because they have a disability, but it is more general compensatory benefits that are not, as I said, so often linked to the specific needs of the individual. We have a study looking to some of those benefits related to health insurance, non-cash benefits, and old age income, but there are still in that study shown some challenges. As I said, to bring the social protection into a more a rights-based approach, compensation of those extra costs. In fact, we have figures that show that the risk of persons with disabilities for poverty and social exclusion is 28.4, while for persons without disabilities, this figure is 18.4. We have now another area in the strategy that is based on equal access and non-discrimination. And there we still have, at the time of writing the strategy, that 52% of persons with disabilities feel discriminated. Here, as you might have known, we continue trying to agree with the member states the directive that was adopted in the year 2008 on non-discrimination, equal treatment of persons with disabilities. At that time, the Commission proposal stated that in order to ensure equal treatment of persons with disabilities, there is a need to have reasonable accommodation, but also anticipatory, effective non-discriminatory access, which is very much about accessibility. This directive is being negotiated, and different changes have been done. I really think it's important to protect persons with disabilities in the line with the CRPD for that. Many other actions are in this area, like, for example, the alignment with the 2000 Hague Convention, which I know that it is problematic that the CRPD committee has said that the wording of that convention clashes to a certain extent with the CRPD, and a solution needs to be found. Also, under this area, we have access to justice for persons with disabilities, and you can see that now the scoreboard on access to justice contain specific references to the situation of persons with disabilities, barrier faced, but also accommodations that are being provided in the judicial system. We also have got some measures related from this prisma of non-discrimination to in the area of education. We're talking about a toolkit for including education, early childhood education, paying attention to teachers' education systems, and an action plan to education and support and inclusive education. This is a sensitive area because the content of education is exclusive competence of the member states, and the Commission, the EU, can only act to support member states in their endeavors. But figures tell us that 20% of young persons with disabilities leave school earlier, while persons without disabilities, only 9%, 9.8% leave school earlier. And also there is a significant gap in attaining of tertiary education, being for persons with disabilities about 30%, and for persons without disabilities about 43%. We also are paying attention to the area of healthcare in the strategy. There has been a study that is about to be finalized, addressing the right adequacy of health provision for persons with disabilities, because statistical data tell that persons with disabilities report 4 times more unmet health needs than those without disability. Also, attention is being paid in the area of cancer prevention. Finally, in this area, attention is being paid to art, culture, recreation, leisure, sport, and tourism. And the idea is to ensure that persons with disabilities have the right not only to enjoy, to have access, so accessibility measures to these areas, but also that they can enjoy the creation, be actors, active actors in the creation of culture and art, and enjoy and participate in sport and tourism. Finally, in this area, we have issues related to safety and protection, and this can be placed, for example, in the gender equality strategy, in the strategy of the right of the child, and initiatives to support victims of violence who are persons with disabilities. Also, FRA is doing a study on living in institutions, and mostly focusing on the complaints mechanisms, and in those institutions, how can that feedback being provided. Also, I think that the study of Eurofound in the situation of living in institutions is very interesting. It was published last year, and I really invite you to read it. There are also initiatives related to asylum seekers, identify persons with disabilities, and providing accommodation, and including dealing with, for example, interpretation of sign language. The next area of the strategy that I would like to address is about promoting the rights of persons with disabilities globally, because there are about 1 billion persons with disabilities in the world, and the EU is an active partner with those countries around the world, together with the member states. It is, in fact, the biggest donor of development cooperation around the world. And to that end, the toolbox that we have on the rights-based approach on development cooperation will be updated. And there has been a network of disability contact points in EU delegations, and the development aid is being monitored through the OECD marker, disability marker. Let me say that in the 2 areas, in conscious of time, in the last 2 areas that we have is about efficient delivery of the strategy. And there I would like to highlight the disability platform, which is expert group of the Commission, and now a formal expert group of the Commission that brings together member states and civil society. The platform was established immediately after the adoption of the strategy. It has an annual work program and discusses the implementation of each of the actions of the strategy. And where needed, we have focus groups of subgroups. For example, we did one for accessible EU, for the employment package, and for independent living and the framework of social services, so that the group can deliver. There is also an annual conference organized through the platform and the presidency, targeting key developments in the Union on disability. In the area of leading by example, there are also quite a number of initiatives for our own employees, but also on the accessibility vis-a-vis the interaction with citizens with disabilities. We also support NGOs, EU-level NGOs, through the Citizen Equality and Rights and Values program, so that they can participate in EU policy making. There is also awareness raising and governance initiatives such as the European Day of Persons with Disabilities, and the Access City Award that aims to recognize remarkable or significant initiatives in the area of accessibility taken by cities. We did have a campaign at the beginning of the strategy, Together for Rights campaign. The website contained quite a lot of information about the different initiatives. There were persons with disabilities contacted at national level. And let me finish by saying that, highlighting that the achievements of the strategy in relation to the European parking card and the European disability card, the employment package, accessible EU, is a start. I mean, it really covered the first part of the strategy, and that currently now we are reflecting on the second part of the strategy, on whether we need to revise the objectives and revise the actions. Commissioner Labib, who is our new commissioner, indicated in the Parliament her commitment to make sure that this second phase of the strategy will be properly implemented, and that actions where needed will be identified. So that's my presentation. I had also prepared a few words about the European Accessibility Act as an add-on to the presentation, as a part of a key instrument that is going to be very soon applicable. In fact, on the 28th of June, the European Accessibility Act will be applicable. And I would like to highlight it because it's requires that certain accessible products and services, and those are important products and services because they have a strong digital component and they are really pervasive in all areas of life: computers, operating systems, telephones, TVs, e-commerce, have to be accessible from June 28. I will not go into more detail unless there are questions, and with this I pass the floor to Delia to address possible questions. Thank you.
This podcast is brought to you by the IIEA, sharing ideas, shaping policy.